Hi, we're excited to invite you to be a part of something truly meaningful. Purpose-Inspired TV, a faith-based streaming channel and social media outlet focused on helping people discover and live out their God-given purpose. We're building more than just a media outlet. We're creating a like-minded community of content creators, coaches, teachers, business owners, faith leaders, and everyday people who are passionate about making a real impact, locally, nationally, and even globally. Our mission is simple but powerful. Help people in every area of life. Uplift and inspire through positive, purpose-driven, collaborate on real-world projects where there's need. Whether you create, teach, coach, or simply have a heart to serve, there's a place for you here. We believe that if you're human, you're worth helping, and together, we can reach and impact more lives than ever before. We can change lives and grow together. Our numbers are small, just like all the other platforms when they started. But as we grow, we will help you grow as a family. We will work together and pull each other up. If this sounds like something you're called to be a part of, we'd love to connect with you. We can participate on each other's shows. We can partner with each other on a cause. You can get a time slot on the channel. You can be a sponsor on the channel. Let's work together with and for a purpose. Don't just watch history, let's make it. Get inspired, Purpose-Inspired TV.
What's up, everybody? I pray everybody is doing well. We are back in the house again. Just gotta say it. I got a special guest tonight, but I'm not sure where my special guest is, so I couldn't change the show. So if she pops in, I will add her in. But what I'm gonna do, so we're gonna be talking about cancer. So she's a cancer survivor. So she was going to tell her story. I'm going to say, instead of was, I'm going to say is. She is going to tell her story about surviving cancer and how she regained her health through her eating healthy. So again, if she pops in, I will bring her in the show. But until then, I decided let's go ahead and talk about, since this is talking about health and health care. So one thing, a lot of us, we see a lot of this stuff going on in the news, the cuts. There's so many cuts going on right now, and a lot of promises are being broken. So one of the promises that Medicare and Medicaid was not going to get cut. So yes, they kept saying campaign the Social Security was not going to get cut. Medicare, Medicaid wasn't going to get cut. The VA funding, those things like that were not going to get cut. But that turned out to not be true. They are cutting millions upon millions of dollars, probably even trillions of dollars. It's crazy. That's a lot of money. And that money is hurting a lot of people. And I don't think people understand. A lot of people, I guess that, no, that's not them. Yeah, a lot of people don't understand the healthcare. So I hear a lot of, we got to get rid of the healthcare to make sure the immigrants don't, the immigrants are getting it. That's not true. I hate to keep on going down these dark paths, but it sounds like history is repeating itself. So when even just last night, I was talking about when Medicare, Medicaid was first put in place. So that was back in 1965, during the civil rights movement. So they knew they needed some kind of help from the government, especially so the Medicaid is for the elderly. So they needed some kind of way to have medical support for the elderly. So we didn't have any kind of safety nets or anything to help the elderly. So they came up with Medicaid. And but the sad story, we got to tell the truth, got to tell the whole truth. It wasn't, they didn't want people of color to have benefits also. So they just wanted, hey, white people, let's give them some benefits. But the elderly black people, they didn't want them to have the same benefits. So then they had Medicaid. So Medicaid was for low income families that, very low income families, children. So most of the Medicaid is covering 40% of that money is going to children. And then pregnant women, it helps pregnant women. Also, many people with disabilities, that's giving them health care. That's not paying them. That's giving them health care, health coverage. Low income seniors in nursing homes. So it's a way to help with people with their health. So that's getting cut. So now what about other people? That's where goes back to Obama. They call it Obamacare. The Affordable Care Act, they fought tooth and nails for years to have another area. So we got the Medicaid for the elderly. We got the Medicare for the elderly, the Medicaid for the extreme poor and the children and the disabled. So what about other people? So the working people who couldn't afford the regular expensive insurance. So that's where the big fight was. So everybody, should be a way for everybody to be able to have health care. So if you was on a rock, that's what the deal is about. Mm-hmm. So we need a way for everybody, no matter where you fit in, to be able to get health care. So Affordable Care Act. The people in office didn't like that. They don't want people to have the ability. They don't want the government to help people have health care. They don't understand people making sure that somebody stays healthy is cheaper than waiting for somebody to get sick and then paying, many times over the money to bring them back to health, bring them back to life. Actually, it's more probably, in bad shape. Without medical care, people end up being in bad shapes, and then they run and have the government really foot the bill to help people in emergency rooms. So, yeah, again, all these cuts, like, what's the point? So who's getting hurt? So that was my question. Who was getting hurt the most when all these cuts take place? Remember, like I said, with Medicaid, Medicare, I've been mixing them up for years. Thank the Lord, I haven't had to have any. So I guess when I get of age and need it, I'll figure it out then. But Medicare is for seniors 65 and above. Age 65 years old and above, and people with disabilities under 65. So you have to have disabilities. So they're saying around 65 million Americans dependent on that. 65 million Americans dependent on it. So that's a lot of, as we see, majority of them is elderly, disabled individual, people on fixed income. So we be cutting millions upon millions of dollars. So now we see millions of our seniors are going to be losing their Medicare. And then there's Medicaid for very low income families to help them keep their children alive. Children, like I said, it's more than 40% of the children in the United States are on Medicaid. And you say, why would so many people be on Medicaid? If the people are not getting paid right. So people had a decent income, they would make more money and wouldn't be able to qualify for Medicaid. And then we have it is designed for helping pregnant women. And again, back to people with disabilities, low income seniors in nursing homes. So the Democrat is affecting the working poor, and they say especially the Black and Latino communities, but legal citizens. So they keep saying they need to get rid of it because there's so many illegal, undocumented, I hate to say illegal, undocumented people on Medicare and Medicaid. What the truth of the matter is, you have to supposed to be got to be a citizen, but those for non-citizens is for emergency basis only. They might, you might have some emergency for a temporary time. Yes, they might get some service then, but they don't qualify. They can't qualify for permanent health care. And again, it's health care. So I think some people think, hey, there's Medicare and Medicaid, they're getting free money to sit home and do nothing. It's Medicare. It's for medical, for you to be able to go see a doctor. It's not a paycheck to sit around and do nothing. So that's what's crazy. And the VA is similar. So the VA for the veterans, they have the VA medical coverage. So a lot that's for what veterans, mostly disabled veterans and older veterans and homeless veterans. So that's what that's set up for. But they're cutting, as far as I understand, their funds are getting cut also. So so who's going to be affected with that? Most of the older and disabled veterans and men with chronic pains and chronic issues, chronic conditions. When they start cutting back and cutting the staff, cutting back on the hours of operation, it's going to affect a lot of people. So you see, so across the board, millions of people are going to be affected drastically by the cuts. So who gets hurt the most by the cuts? So let's see, I'm trying to show who gets hurt the most. So the low-income seniors. Low-income seniors. So the seniors on paycheck to paycheck. Many of them don't have the ability to go back and work and get, work a job. Like, fixed incomes, they get a certain amount of money. They have to figure it out many times to the penny. So if they barely making it now, they're barely covering their medical, and if you're getting cuts, and then okay, so now I don't know actually how it works. So I would say if they need, money, if the medical was taken care of, then they say, okay, that used to be free, but they have to pay for this, but we don't have any money to pay for that. I'm sorry, you have to pay for this now. Have to pay for this now. Many things that you didn't have to pay for. The fundings will take care of it. May even be the medicine. They don't know. I think a lot of people, they don't know. They just did the cuts first and figured out later. I think that's how they did it. We're just going to cut it, take the money away, and we just suffer the consequences. I even heard, well, I didn't verify this myself. I ain't verified. So if I'm wrong, I'm sorry, I could be wrong. But they said they was talking to Dr. Oz. Dr. Oz is part of the administration, I believe. They was talking to him about it, and somehow, I don't know if you can find the video, there was a carrot cake on the stage, on the desk, and they said he cracked a joke about what should they do about their health care now since there's so many cuts, and he cracked a joke about they need to just eat less carrot cakes or something like that. It's just a lot of people who don't need it are kind of heartless. A lot of the politicians, they're disconnected because they got health care and funding and support for the rest of their life. So they got health care. So that would have been one of my strategies. If the people can't have health care, you can't have health care. Not until you solve the health care problems, you can't have health care. So the more you cut, the more they should be cut from them. But they don't do it that way. But that's what I would suggest and recommend. So who else is affected by these funding cuts? Disabled individuals who need long-term or specialized care. So yes, this is a lot of those things are very expensive. Yes, and the government pays for it. Yes, and the government probably work out deals so it wouldn't be as much as an individual having to pay for particular services. So I can't even imagine, but what situations that the disabled are getting, or different access to different things they were getting. Now the funds are getting cut, so they don't have access to that anymore. Children in poor households are going to be affected. So a loss of routine care, no vaccines, no dental, no checkups, no blood work. Many of those people are going to lose that coverage. So again, if the people don't have the money, they're not going to go to the doctor. So that means one sick person in an apartment building can make the whole entire building sick. So it's more feasible to make sure everybody's kept healthy. So who else? People in rural communities. So I've been hearing about that. Fewer clinics, fewer hospitals. Medicaid keeps them open. So I think as soon as they sign that bill, I think people are already saying a lot of the rural areas, a lot of hospitals were getting shut down because the Medicaid, the money was coming in to help keep those hospitals open. So since the funding has been removed, a lot of hospitals had to be shut down or gonna have to be shut down. So now people in the rural communities, and a lot of people keep saying, you voted for this. So they out in these different places where there are few hospitals far and few between, and now the ones that they can reach are going to be shut down because of the cuts. So again, like I said, they didn't count the cost. They just cut. Veterans with PTSD, chronic illness, and mobile issues. So I don't know where I know they could. I know they was like cutting the staff for the VA. They may even close some locations or cut back on different services. So that's going to be affecting people, maybe even the medicine or outreach to reach like the homeless, the different people that needs the help. So money get cut, it's going to cut and affect somebody. And the working poor who earn too much for Medicaid, but not enough for private insurance. So they're right there, just like at the poverty line. So the government set it up. Okay, let's look at your income. This is your income. So, okay, now you qualify. Not doing anything illegal, but they're working and doing stuff legally. But the pay should increase. If all these major companies boasting about all the millions of dollars that they're profiting from the workers, it should be able to come down. That's what the policy of the trickle-down economy, they say, let's make the rich people rich, and they're just going to trickle it down and let the wealth run down to the poor folks. Needless to say, that didn't happen. But they still had the same mentality, so they tried it again. Do a lot of tax cuts for the rich, make sure they don't pay into the system, so they need some money to fill in the gap. So you go to the poor people and you do the cuts. And if you notice, you can go look it up yourself. I like saying that. Look it up yourself. They keep saying, the certain party wants to be responsible with the funding and the finances and all that stuff. But you can go back through history. You can see that when the Democrats were in power, yes, some taxes went up, or they made the wealthy pay their fair share. We had a budget. We had things in budget. And sometimes we even had a surplus. Can you believe it? We had a surplus when people were able to put their taxes in fairly. But then when the other party comes in, the deficit started rising. Then they started doing the tax cuts. So, but if the taxes for everybody, all I can say, it's just crazy. It's crazy. So, what to expect with just like pretty much everybody. So even if you still have health care, let's say let's go back to the rural community. Let's say you got a good job and you got very good health care, everything is covered, but you live in a rural area and the hospital closed. So it doesn't matter what kind of health care you had, it affected everybody. So now your spouse, your children, your loved ones, even if you got coverage, if there's no hospital there's no care anywhere around, what's the point? So it's going to be delayed of care, or they may avoid care. So I think that the mentality I had, so I guess it was the wrong mentality. I guess I was listening to conservative news where they were saying that if there's a universal or a government health care, they will, just put a price tag on you. But I mean, the price tag is how much are you worth to the country? How much are you worth to the society? And if you're not worth much, you can get put in the back of the line. So, and you homeless, you not making much money, can't work. So we're going to spend a lot of money on keeping this person alive, or are we going to make sure other people that's going to be more worth more to the society? So that's what they had me believing, how Canada system was working. But it doesn't have to be that way. But it's, so that's the way they made it look and sound to make people be against it. So like I said, at one point I was against any kind of government health care, because I'm like, yeah, they start looking at you as numbers instead of a person. Yes, it's easier to let you die. So we have a $100,000 operation to keep a homeless person alive, and if they don't do it, he's got only 6 months to live. So they probably go ahead and approve the operation, but they probably approve for the operation to happen in 7 months. So they say, okay, we approved it, but we set the date for 7 months. So you see how that works. You gaslight, not gaslighting, but trying to act one way but do another. So higher mortality rate, more people dying. That's really what I'm already talking about. A lot of people are going to be dying if you don't have coverage. Like, imagine no healthcare coverage. You don't have any preventative service. So something's going on, the doctor's not going to catch it. So a lot of people are going to be dying just because they don't have any money to even go to the doctor for any kind of services. Or then other people, the stuff's going to be so expensive that people are going to be holding off until, again, might be emergencies. Yeah, I have health care, but every time I go to a doctor's visit, it's going to cost so much money. So we need to wait till you're almost dead, then we finally get to go in. And imagine the mental health crisis due to the loss of the health care for the mental health. That's what I'm talking about, mental health. So they don't have access to the medicines, don't have access to the counselors, or people who have mental illnesses and they need to get to a counselor for the counselor to let them know what they need, or they don't cut back. So now there are very few counselors to handle the situation. Um, and then you remember, like a lot of people, so we can't afford the regular care. So there's some who don't have it at all, then others who can't afford it. So both of them, many people are going to be waiting for things to happen at the, to go to the emergency room. So now can you imagine? So now the emergency room is the prime care. How you say that? Your prime doctor. It's not what I say. But anyway, so yeah, so now the emergency room might be the only time. Hey, when the last time you been to the doctor? Last time I came in here to the emergency room. Y'all saved my life. You patched me up. Went on about my business. Did you do follow up? Probably not. Don't have any coverage for follow up. So now they got to wait and they get infections and all this kind of stuff. Got to get so bad, then they got to come back. After it gets bad, they got to go to the emergency room again. So that is not financially feasible for the country. So what's the economic impact on the country? I said it before, a lot of hospitals are going to have to close, especially the ones in the rural areas where there's not that many. They don't have that large of a community. They have, they're spread out. So a lot of people probably come to that hospital. They wouldn't have put it there in the first place, but the funding from the government is not coming in. So now they're closing. So now you have a lots of driving to get to hospitals. So imagine being able to get to a hospital 20, 30 minutes. Now it could take an hour, 2 hours for the closest hospital. So people can have plenty of time to die on the way to the hospital. So a lot of people are going to lose their job, especially in the healthcare industry. If all this funding has been taken away, so that's basically a lot of people's paycheck has been taken away. So there's millions of people going to lose their jobs. So now they're going flooding the workforce. I guess that's the point. They want them to get out into the fields and pick that cotton. So a lot of people are going to be going into debt, trying to take care of a medical bill. Sorry. You would do anything if you're a parent and your child is about to die, and the people are saying we're not going to take a look at do anything for your child until you show us how you're going to pay for everything. Don't you know, a lot of them parents, they can be signing, and they was like, okay, we don't know how much it's going to be, 100,000, 200,000. So pretty much, some people might be putting their houses on the line, everything they own on the line, to save their loved one. So a lot of people can be probably in major debt. But you saw the previous administration, they took the medical debt off your credit score. But just recently, the new administration put it back. So people had, thousands upon thousands of dollars of medical records and medical bills that kept them from doing things in society, moving forward, building their life, because the credit was bad because of the medical. Then they removed the medical, and then the credit got good. So now they was able to get a house, start a business, do different things that they wouldn't with the bad credit. So now this administration decided, nope, let's put it back. Let's put that burden back on our lovely American people. So again, there now, if the people don't have any health insurance, somebody got to pay for it. So now you got all these people with no coverage, no insurance, going to the hospital. So a lot of times, the local and state governments have to cover that. So it's cheaper for the people to have coverage than for them to just walk in and use up all the emergency funding they have. So unless they plan on doubling, tripling, quadrupling their emergency funding. So the public, what's going to happen to the public? We take away all the health care. People can't go to the doctor. People can't go and see what those bumps are. They can't go see what that lump is. When they can't see all that, if they might have thought they caught something or something in the past and they had coverage, they would have went to the doctor. Now they don't have coverage. So now if they might think they have something or caught something, they're not going to tell anybody. So now probably diseases are going to start spreading. Could be more outbreaks because if you got coverage, as soon as you feel something, you're going to the doctor. If you don't have coverage, you're not going to go to the doctor until you're half dead. And then you'll make it there. And then, oh, this person is contagious. This person needs to be quarantined. But imagine all the people that they've already affected by the time they get to the emergency room. So a higher disability rate from untreated conditions. So there could be some conditions that the doctor could find, treat, and be done with it. But since we can't go to the doctor, can't afford to go to the doctor, don't have the coverage, now you got these different issues that the doctor could have fixed but can't fix since he's not fixing, making it worse. So now since it's worse, now you're disabled. So now maybe you probably get on Medicare now, and then you probably get some coverage. Now they can fix you. Increased homeless among disabled and mentally ill. So it's going to be cuts for them, cuts for programs that was helping them. What can people do when they don't have funding? So when they're doing the cuts, what do? You find out you and your family is affected by this. You getting cut, or they say you make too much money when you at the poverty level, or you can probably, I don't know. Okay. If you make too much. Anyway, they give you a reason why they're taking you off the program. You got the wrong last name. You speak Spanish. It's crazy out there. So what do you do? So there's still some lungs of funding to keep coming in. There's some free or quote unquote sliding scale. That means kind of like pay what you can pay type thing, or free clinics and different things. But there's still donors and nonprofits have to keep those funded. Church-based health ministries. So sometimes they have these events, like I've hosted and helped do some different events where we invite people out that provide different services. And so, like, for example, they have the mammogram bus. So the mammogram bus will come out and give women free mammograms. Doesn't matter what kind of coverage you got. They was offering the mammograms. So there's going to be other people that provide those type services, and you can get it in. But so that's when like the church is trying to step up, or the state health programs. So the state tried. Some states will. I know some states are not, but some states will. Okay, so all this money was taken away from the federal government, so we need to put it back in to keep our government going. So now the state probably jumps in to try to cover it if that's the type of state that's got the money for it. Mobile health units, especially in urban areas, so different people, even people like to donate. They can put money together. We're going backwards in history, but they can put money together and come up with their own, like ambulance service or search and rescue service or help service. Since the government is refusing to do different things, people had to resort to taking care of themselves. I think, did you know it was people of color was the ones that started or I don't know if the word is invented the ambulance service, where they would call the police. I think it was in Philadelphia, if I'm not mistaken, where I don't think they didn't have that type of service, but if they called for help, like they would send the police to help certain situations, they got to the point where the police wouldn't go to certain neighborhoods. So they were on their own. So in these neighborhoods, they decided to, we need to look out for ourselves. We need some way to go pick up somebody that's hurt and then get them to the hospital before they die. So that started by necessity. And so not only did they start it, they trained and became very good at it until other places around the world started doing the same thing. So that started in the quote unquote Black community because they had no other services. So they decided to provide services themselves. So what is something that you can do to prevent? So tonight was going to be the subjects we're going to be talking about eating healthy. I didn't hear no beeping. Let me just check my phone real quick, see that my guests. Nope. Okay. So yeah, we're just going to talk about eating healthy or preventative services, preventative care. So if you don't have the coverage, you got to pay more attention to your health. You got to watch your diet. You got to get up, get to moving, and get your body in shape as best possible, and eat right, eat the best food as possible. Because you're trying to hold on, you're trying to make sure your car don't break down. I'm talking about your body, make sure it don't break down, and have to figure out a way how to get services at the hospital. Also join groups, share the knowledge, share the resources. And there are even some groups of people that put their money together to even start to provide healthcare. I know it's a Christian-based one for business owners I was looking into. So there are different organizations where a group of people put your money together. You put your money, you're starting to own healthcare funds, health advocacy groups that can help cut some of the rates, like AARP. Yep, I'm in AARP, been there a couple of years. But did you know you don't have to be that old to be in the AARP? I think they lowered the age limit. So you don't have to be that old. I think it used to be 50. Yep, brand new. You don't have to be 50 to be in AARP. All right. And so healthcare cuts don't just hurt the poor or don't just hurt the immigrants that they think are a benefit from it. It hurts the whole entire system. It hurts the whole entire system throughout the whole entire country. You cut Medicare, it hurts the system. Medicaid hurts the system. The VA services, it hurts the system. Any of these services taking things away, it hurts the system. I know, yes, we're supposed to be financial stable. We're supposed to have a pay our way, but we're in this situation. Like I said, many of these situations, the government took the money out of the different things. They took money out and didn't put money back in. I'm checking again. Nope. Won't keep beeping. So that's anyway. I just want to give a little rundown about the health, the healthcare, the big cuts, all these different cuts to the healthcare. It's going to affect the entire country. It's not just going to hurt small people. Again, I think the biggest I think the biggest hate, yeah, people on it that shouldn't be on it. So we can make sure they get up and go to work. You know, most of the people already working. It's like you're not gonna make somebody go. What are you to have? I think to have health care. I think thinking that people are looking at, okay, they got health care, so that means they get $1 million check every month. So that means they get to sit home and do nothing because they got that $1 million health care check. That's just as crazy. They had access to medical. That's what it is. Access to medical. Seniors. I mean, I don't even want to go through the list again, but there's certain people that health care is provided for. So now it's taken away. So a lot of people, it's going to be a shock. And really nobody, it's going to be a shock to people, a shock to the system. So people are going to have to figure out other ways to survive. And it's good. People are learning how to not depend on the government. So that's, yes, we got to learn how to not depend on the government. We got to figure out how to survive. I tell you, I always tell the story, back in the day, I don't remember. I went to the doctor when I got my brain concussion. I fell on a brick with my head, but outside of that, I don't remember too many times going to the doctor. Yeah, you got to get your shots and stuff before you go to school. That was about it. So I got this big old gash on my finger. I got this big long gash where I got it cut. I was with my stepdad. We was out in the woods, and I cut my hand. I can trying to think of the story. I think we were going to get some firewood. We were going to get some wood. We were going to get some wood out in the woods. So I think we had at a certain time we had a fireplace or wood stove. Yep. We did not have central heat and air conditioning. That's no, we had an air conditioner. We had one room. Remember, we had one room that had air first. I thank God stuff got better over the years. But we had one room with air conditioner. But we had heat. The main room for the fire, the heat, was in the living room. So we was going to get some firewood. So I can remember he cut the tree down. So the tree was cut on the ground, and then he was chopping up the different chunks. So for some reason I had to put my hands under the tree that he had just cut down. And as he was cutting, as soon as he cut it, the weight of it, I might have been faking lifting it, but I can't say that. I was holding it up somehow. I was holding it up for the saw to work. So I'm holding up the tree, and he is cutting it. And when he cut it, all the real weight went straight to me. And when it went to me, all the weight went down on my hand. And when my hand went down with this log on it, it landed right on a piece of glass and slashed my finger. So should have got stitches. I ain't know nothing about no stitches. But my stepdad, he grabbed a handkerchief, wrapped the handkerchief around my finger. And we finished cutting the wood. And I guess I went home and might have put something on it. But as you could tell, I hate to keep talking about this. It's a big gash. It should have been sewed up. So I didn't get it sewed up. I got another gash on my leg. It didn't get sewed up. But we didn't go to the doctor like that all the time. But it's sad that we might be reverting back to those times where stuff's going to be so expensive, and the government is saying that they're not going to be there to help you. The federal government is saying, no, we're not going to help you. Figure it out on your own. Then the state government can turn around and say, it depends on what state you're in. So certain states going to try to look out for you, other states are not. So imagine the state government, federal government saying, nope, we can't help you. You cut your hand, we'll figure it out. Then the state government, well, sorry, figure it out. We can't help you. So a lot of people are going to be going through some situations And I believe there's going to be some loss of lives because of the cuts. But still, the people who make the laws, they still got their service. They got their coverage. I forgot where I was going to, something else I was going to say, but pay attention. That's all I get. That's more than I can say. Pay attention to what's going on. One of the newest things that just, it's so many things that's happening, but one of the newest is, if you understand the Bible, know the Bible, read the Bible, continue to read and study the Bible, you understand the Bible teaches in Revelations about quote unquote mark of the beast. Well, I'm not really too concerned about what that's going to be. Some people are going to say it's a chip. People, they got chips in people now already. But the mark is really, imagine, let's outside of a physical mark. So that could be very well could be a mark on somebody's forehead and somebody's hand. But symbolize, if you got the person's brain and you got the person's hand, you can get them to do what you want them to do, right? You got control. You guiding them by the brain. So a lot of people already got the mark. When I say the mark, so the believers, when you give your life to the Lord, you got his mark. What's his mark? His word. That means you're going to be obeying him. So that's why we can't get the mark. We already have his mark. So as his mark, we listen, obey, and we do what he tells us to do with our hands. So that's the forehead and the hands. But, okay, so what just happened recently? So over the years, every time somebody come up talking about a system to take away the cash, to make the country, you go into a cashless society, most people, they fought it. Both parties, I think, in our country, Republicans and Democrats, they both fought against it. They didn't want that to happen. So I'll let them it will fail. So now it came up with the administration. Now the administration is in power now. It came up with them, and they got a lot of resistance, a lot of pushback. So they stopped it. So they brought it back again. So now it's just approved over a couple of days ago. I think it was Friday, for us to have a digital dollar, so digital currency. So so what? That means they have control over everything. They're gonna have control over all your spending. They can track everything. You see, they already can track us with just our phones and different things and computers and stuff. But now they just approved it as of Friday, the digital dollar. And to get people to start using that digital dollar, they have to start getting rid of the regular dollar. That's the same way they use it. They did the same thing in other countries. I can't think of the countries right off a hand right now, but I know there's other countries that's been doing it for some years as digital. One country, they outlawed their currency. They outlawed the currency, and then they switched it over to a new currency. So imagine all our green money. I'm just saying. One day, let's say all our green money. We still have, a lot of places. A lot of people still, they already getting trained and molded to operate in a cashless society. Actually, I'm filling with an old credit card right now. We are trained to swipe and then to tap, or now they went from the card to your phone, just tap. So that's the training. That's all of us. We're going through training. So now imagine the chip that you got in your phone is put in your hand. So people already got it under their skin, and now all your information. So anyway, so get back to the dollar. So now they plan on they signed the bill for the digital currency, the digital dollar, A lot of people are hot. Some people who, like Miss Marjorie Green out of, and she's in Georgia. That's one I thought I would never, ever agree with anything that young lady has to say. Nothing whatsoever. But she is totally against it. But it's kind of too late. It's past. So real soon we're going to start seeing the implementation of this digital currency. So the government wants us to switch over. You remember not too long ago, they were saying the government wanted to have access to your accounts like Cash App and those type money sending apps. Maybe at one time they didn't have any access to that. So then they wanted to have access to it. So now here we go. If we haven't switching over to a digital dollar and it's hooked up to crypto, so it's even more especially, I ain't throw that in there, but the digital dollar, to where they can force you to stop using the dollar. Like I said, like that country, I can't think of it. Like I said, one day they had a currency, then they put out some new currency. They outlawed the old currency. Then they said you have to use the new currency for the people who refuse to switch over to the digital currency. So then what they did was they limited the amount of money that you can withdraw. So the people who was like, okay, I'm not going to use this digital currency. I want to still continue to use cash. They didn't put enough cash in the system for it to work. So the cash crashed. So everybody was forced to go and use the cashless system. So I can see that happening right here in America. So again, we just approved to have the digital dollar. So any day now, anytime now, I think they've been working on this thing for years. So all they got to do any day now. Well, let's just say I'm not sure how close they are to go ahead and hitting the switch with the digital currency, but they're ready. So, but a lot of people are resistant, but they can do the same thing. They can outlaw the dollar. You can no longer use the dollar, or we got this new. So, we got this paper dollar, paper cash, and it's carrying diseases. So we decided we're going to use plastic currency like they do in other countries. So that, they can say something else. Like every time you pass a dollar bill, you're going to be catching this new virus. So we're going to ban those, and then it's going to just have these plastic. So they can do the same thing. Okay, now the green currency is no longer valid. You have to use the pink plastic currencies. Same thing. We don't have enough. You got to come to the bank. But you got to use your digital. You still got to log into your digital system to be able to get the plastic money. But again, they probably don't have enough in the system. So now you force to use and get on board, sign up, get on the digital system. So now they can track your move, everything that you spend. They already see where you're going. Now they see what you're spending on. And let's say the government is doing a lockdown, and you want to move about, they can freeze your card, lock your account down. They say freeze your card. Yeah, they can lock your account down. Or you owe something. They're trying to find you. It's just way more control. It's kind of funny when they saying that it should be, the government should have less invasion into your home. They should not have their hands all in your home. But a lot of these things has been passed. It's getting them more and more hands, giving them more and more power, and taking power away from us. It seems like every day. The civil rights are under attack big time. So a lot of the civil rights and birthright citizenship is birthright citizenship. So it's fragile. Any of our rights, they try to, the ability to vote, they're trying to take that away. They're already working on women. I don't know if somebody different up here listening. The plan for the women is if your name don't match your birth certificate, they don't want you to have the ability to vote. That means if you was born, making up a name, your last name Brown, you married a dude named White. Now White is on your driver's license, and the driver's license don't match your birth certificate of Brown. they're not going to let you vote. They send your birth certificate. So that's another way, a subtle way to start taking rights away. Now they're attacking the birthright citizenship. So now they starting off saying it's because of the immigrants. If you see the people in office, a lot of these politicians who are pushing this, that's how they got here to the country in the first. That's how they got their citizenship. Isn't that crazy? I'm gonna say, calm down. It's kind of crazy how you use a system to come to America. Some people that were not citizens and were able to get their citizenship. Some came here, their family came here legally. Some of them came illegally, and they was born here and they became citizens. So now they got this power, and now they want to, imagine, they got that fence, not the fence, a ladder. You put the ladder, so you climb this ladder and made it over to the United States and got in it. And then what you're going to do, you get up there, kick that ladder, make sure none of your people able to come into the country the way you did. That is so dirty. That stink. That's just nasty. That's how you got here. That's how your family got here. And you're making sure that nobody else can come into the country. That's just dirty. But yeah, they want to take away birthright citizenship, want to take away the right to vote. They're taking away the health care. They're attacking the education. They're removing history, banning books, anything that tells the truth and that doesn't make America look like a perfect, sparkling angel. They want to destroy it. It's unreal. It's no way to sustain a system like that. But okay. I see some comments here. What we got? I got some from India. India, they're gonna keep paper currency. Now that's what I'm saying. They are attacking. They are planning on getting rid of the paper currency. They don't want it. They don't want you to be able to go shopping and buy stuff without them knowing about it. They already tracking us. Did y'all hear about the sidewalk? I think I told you that the side is a when I say sidewalk, is the you notice a lot of people are getting the rings, and we got the rings, we got the Alexas, and we got these different devices in our home. That it's this thing called the sidewalk where they can cut it on. So whether you have Wi-Fi or not in your home, they still will provide. It will still be service in your house to provide service for devices in your house to send them information back. That's it. Okay, so I know that. Did that make any sense? Okay, let's say right now you have a service. You have a internet service provider in your house. So that's providing Wi-Fi. So it's sending a signal throughout your house. And actually, they said they can see you. They have something in the modem, but they can be able to see you. That's something that's getting even deeper. But so that's putting a signal in your house. So that means all these devices that they've got us to hook up. So all these devices are collecting information on us. They sell that information. So the ring, you see all the rings and those type cameras, they're tied to each other. So all these report criminal activity, or there's different things. But anyway, still can send some information. They can tell every day you leave the house at this time. Every day you come back home at this time. That's information that they're gathering and selling. So let's say you decide one day, I don't want to use this service. I'm going to cut my Wi-Fi off. I cut my Wi-Fi off. All those devices stop working. Well, those devices stop working for you, not for the system. So you think, hey, my ring is not working. It's not sending information. It is. So now what happens when you cut your Wi-Fi off, it connected to your neighbor's Wi-Fi or the Wi-Fi in the street. So that's why they call it sidewalk. So Wi-Fi is going to be everywhere. You're not going to be able to tap into it because they want you to pay. So that's one thing. They want you to pay for the service, but they can still use the service. So let me give you an example. And this was an old video. I saw this today where this guy said that he went traveling. He said he had 2 phones. He never hooked his phones up to a service before. He said one of them, but neither one of them had a chip, a Wi-Fi chip in it. One was in the Wi-Fi. One phone was, I think it was off. The phone was off. And the other phone was in Wi-Fi mode. Not Wi-Fi mode. It's called airplane mode. One phone is in airplane mode. Other phone is off. Neither one of them has ever been hooked up to the wireless network yet. So this guy drove around New York. Nope, it wasn't New York. It was Washington, D.C. He drove around. He walked around, drove around, just went all around D.C. all day. Then he brought the phones in to this to the guy that was telling him, I guess I didn't see the whole. I just TikTok, you see the chunks of it. So basically, brought it back to the guy. He was like, "What we're gonna do? We're gonna capture the information before it goes to Google. So it's gonna." However, he tapped into it, plugged into the bottom. He's like, "Okay," because the phone is gonna, as soon as it powered up, it's gonna send all this information up. So he just plugged it in and captured the information. While the phone was off and when the phone was in the airplane mode with no service, it gathered all the information. It was like a few pieces that was missing, but everywhere they went that day, it was in that phone. Even when they thought the phone was off, it was still in the phone. And as soon as he cut the phone off, the phone started saying, he was here at this time. Then they went here. Then they did, and they spent this much time getting in the car. So they could even tell you how that you were getting in the car, how long it took you to get in the car. They got that much detailed stuff that they are selling from us. It's like, how do you get away from it? I mean, it's just like all inner wine is everywhere. But so anyway, I just be aware, be watchful. Where's my time? I don't went over. Thank you. I don't know what happened to my guest I had for the evening. I'm gonna put my last post up there. She says she is ready to leave the country, but go where? Go where? And if you leave the country, you can leave your kids, grandkids, great grandkids, and your family and loved ones. I see these people who saying that they move to another country and how fun and easy. And it's just like I say, I seen a family. I think a man, woman, and his children. And then I seen a single mother and her daughter in like Japan or somewhere like that. They halfway around the world by themselves. So it's fun and all for a little while, and after a while, you're gonna be, if you're a human being, you could be longing for your family. You can be missing your family and wishing you could be able to spend more time with your family. So it's easy to say, yeah, I'm just gonna pack up and leave everything behind. It's different. I've done a couple. You've been in the military, you do that quite often. But to just leave the country altogether and leave everybody behind, and sometimes you may never ever see them the rest of your life, that's a hard decision. So I can't imagine how these immigrants, even legal immigrants, are just being snatched up. I mean, snatched up with no warning and just thrown out of the country or thrown into other countries. All right, that's another story. That's another one. Okay. Thank y'all for tuning in. I apologize. I made a post about a special guest this evening, and I didn't make it through. So I guess we'll figure it out next time. All right. Until then, everybody be blessed and good Joe out.